When I heard I was going to have open heart surgery, I was scared to death.
Well, I passed out, and when I came to, the ambulance was on the way, and they brought me into St. Mary's, and a couple of days later, they diagnosed me with what they call bradycardia, and they put in a pacemaker.
When a patient presents to St. Mary Medical Center emergency room with the symptoms of a heart attack, a lot of things start happening immediately. That is the moment they step in the door.
I'm just kind of riding on this as everybody is directing my life.
Is the cholesterol, is the lifestyle, is the weight management, all those are very important.
What St. Mary has done a good job of going into the community and finding out what the needs are, working with community leaders and assessing those needs in various different levels.
I personally have used St. Mary's Hospital as a model for other organizations within the church to look at how our ministries are mission-driven, mission-valued.
You know, in our mission statement, you don't hear anything about the hospital. You hear about the community. And I think that's very evident here in our community here at St. Mary's in the High Desert.
They went out in an educational manner to help people understand the importance of nutrition, the importance of hygiene, prenatal care, reaching out to communities that are not served by any other healthcare organizations there.
I counsel patients for weight loss, diabetes, high cholesterol, high blood pressure, just a variety of things.
St. Mary's Healthy for Life is a childhood obesity intervention program. They conduct this program in partnership with San Bernardino County Preschool Services Department.
We eat vegetables.
You eat vegetables?
And grains.
And grains. We start through the beginning of the day. As soon as they come in, we do music and movement activities.
We'll shake our sillies out, we'll jump and we'll exercise to a couple of songs.
On the lesson plans, once a week, we do health, safety, and nutrition. So we do activities with food. We do the food pyramid.
Children will do what you teach them. If you teach them to be healthy at a young age, they will also learn to know what healthy and what not so healthy.
They'll come home and go, Mom, you're not supposed to be drinking that soda, it's bad for you.
It educates the entire family on healthy living, on nutritious eating, and the whole family benefits from this program.
Every woman deserves to have quality prenatal care, regardless of insurance or not, regardless of her socioeconomic status.
If it wasn't for St. Mary's Medical Center and actually the Community Health Center and the services that they offer, I don't know how well prepared I would have been to bring the child into this world.
And when you think about it, when you give women dignity at the very beginning of their pregnancy, that translates to healthier babies, healthier families.
As much as possible, we try to be able to address all of their needs: nutrition, parenting education, stress management, as well as basic needs.
When you start responding to one need in the community, it opens up the doors to many, many needs in the community.
We look for partnerships. We look for like-minded people. I think that's key. You know, people who believe what we believe in our core values, and want to build around those core values.
St. Mary's has been extremely proactive of reaching into the community to help address that and band the cities together for a collaborative effort. We have Victorville, Hesperia, Apple Valley, Adelanto, unincorporated Spring Valley Lake, Silver Lakes, Wrightwood, the surrounding areas of Barstow, the great community of Needles, and 15,000 square miles.
So we began a program with St. Mary that involved sharing of resources, and we received some grant assistance from the hospital as well. And we launched what we call Healthy Apple Valley.
They provide the expertise that we don't necessarily have. We don't have physicians on our staff. We don't have nutritionists on our staff. And so St. Mary's can come alongside and review our programs and help us ensure that what we're doing is providing the healthy cities type of lifestyle that we're looking for.
St. Mary's, we've worked with on developing the Healthy Hesperia program and identifying ways and ideas that we could bring into our community to encourage healthy lifestyles with our citizens.
We've started to develop joint use agreements with the school district so that we can use school playgrounds as a way to provide activities. There's a community garden bringing fresh fruits and vegetables to people that live in the northern part of Adelanto.
It was very unique not too long ago when we got to meet with them and see community members and city leaders and so many different people at the table just hungry to learn more about how to educate the community and how to collaborate on making their environment a healthier place.
The social cost, the financial cost is too great at a later point in life. And again, St. Mary's has been extremely proactive of reaching into the community to help address that and band the cities together for a collaborative effort.
The foundation is key to continue the mission here at St. Mary's. The role of the foundation is to connect with those members of our community and really bring them in and together look at what the priorities are.
We've looked at obesity, we've looked at homelessness and some of the other big initiatives that are underway within the community.
It serves the community not for profit, but for health care. It's important for this community especially to be part of growing this hospital back and growing the campus and growing the health care of the whole community.
If you want to get involved, we can find something for you here at the foundation.
I started working as a junior volunteer. When I turned 18, I asked if I could be part of the adult volunteer program. And then once I graduated, I applied here for a nursing position. And 8 years later, I'm still here.
Well, I think oftentimes people feel that their $10 or $25 donation does not make a difference. Every donation makes a difference because collectively all those donations add up to a lot, and together, we're able to do some great things with those donations. The foundation is able to provide money to start a program in the community. That's how Healthy Beginnings, that's how a lot of these healthy different communities with Healthy Adelanto, Healthy Hesperia, Healthy Victorville, Healthy Apple Valley, that's some of the seed money comes through our efforts here.
Thank you to all the people in the community who have supported us through the years since the beginning and who continue to support us today and will continue to support us into the future.
We have good training here, good help, and the right equipment to help us get better.
And this place right here is my lifeline to the rest of my life.
We are a hospital. We don't want them to come to the hospital. We want them to be healthy.
My community is a healthy community.
My community is a healthy community.
And my community is a healthy community.
My community is a healthy and happy growing community.